Well, good morning, everyone. I want to say a welcome to you and glad that you are here. My name is Matt McBurney. I'm one of the vice presidents at Riverside, and I am pleased to be able to welcome you this morning. As you are able, would you join me in standing? We're going to start with the Pledge of Allegiance this morning. Join me, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated. Well, I want to thank you for joining us today from all around this community. I want to say a special thank you for the students from Kankakee High School that have joined us. I know it is a major sacrifice for you to interrupt your schedule where you'd normally be in class and to come to something else, but thank you for making that sacrifice. I think you will enjoy our time together, and I believe that a lot of you are from the health careers area, and so hopefully this is very pertinent to you as well. And for those of you that came from around the community, thank you also. My guess is that you are in the room thinking about women's health and its impact in your life, but knowing a few of the people in the room, my guess is you are also focused on women you care about in your life. And you are thinking about the broader good for those that you love and the broader good for those of us in our community. And so I want to acknowledge that and say thank you. I think you're going to find that this time serves you well in that regard. I do want to do some quick introductions as we get the morning going, and then we'll get right to our panel in just a moment. First, I want to introduce and say a welcome to the President and CEO of Riverside Healthcare, Mr. Phil Cambick. Phil, if you would wave. I also want to say thanks to the Superintendent of Kankakee Schools, Dr. Janera Walters. Thank you, Dr. Walters. We talked about a good place for us to do this. This auditorium is perfect. So thank you so much to you and your team that has made this available for us. As much as I appreciate those of you that are in the room, I would like to acknowledge, too, that K's Media is helping us not only with the live part of this, but they're recording it as well. So this can be used for future instruction for students. And so we're grateful for their abilities to do that and their thought to capture these good things today. Well, I want to introduce our host whose office called us, Congresswoman Robin Kelly's office called us and said, can we put something together? We want to focus on women's health, particularly women's health affecting women of color. And so they reached out to Riverside to say, is there something we could do here together? We were so pleased to be able to work with the Congresswoman's office to make this happen today. And I'm so pleased that she is here with us. I want to do a brief introduction of the Congresswoman. Congresswoman Robin Kelly has dedicated her career to public service for an advocate for Illinois families. Since being elected to serve the 2nd Congressional District in 2013, she has worked to expand economic opportunity, community wellness, and public safety across the state, championing numerous initiatives to generate job growth, reduce health disparities, and end gun violence. Congresswoman Kelly is a member of the House Energy and Commerce Committee, the main policy writing body of the House, and serves on the Health, Communications and Technology and Innovation, Data, and Commerce subcommittees. She's very busy. She is also a member of the House Democratic Steering and Policy Committee, which sets the policy direction of the Democratic Caucus. Committed to improving the health and wellness of vulnerable communities across the country, the Congresswoman serves as chair of the Congressional Black Caucus Health Brain Trust and co-chairs the Congressional Caucus on Black Women and Girls. The daughter of a small business owner and postal worker, Congresswoman Kelly earned her BA in psychology and an MA in counseling. She later received a PhD in political science from Northern Illinois University. She lives in Matson with her husband, Dr. Nathaniel Horn, and has 2 children, Kelly and Ryan. Please join me in welcoming our host for today's event, Congresswoman Robin Kelly.
Good morning, everyone. Can you hear me? All right. I'm so thrilled to be here in Kankakee and see all of you today. I want to thank you all for coming to today's event. I especially want to thank my task force on Black women and girls. Dr. Walters, always good to see you. Thank you so much. And Kankakee High School and Riverside Health, thank you so much. You know, I love you guys for all your work and your partnerships. Today's topic could not be more important, whether you're in the emergency room or at a routine checkup. Knowing what questions to ask and how to advocate for yourself to a healthcare provider can save you time, money, and sometimes even save your life. Our health is our most important and valuable asset, and we need to see healthcare professionals as our partners, not just our providers. I want to thank the physicians from Riverside Health for being here today and for their commitment to providing quality health care to their patients. Your dedication to the health and well-being of the community is truly admirable. I'm working in Washington to reduce bias and improve outcomes for women in health care, but especially women of color, that was mentioned, because of the unique health challenges that we face. We can do more right here at home to make things better, and that's why I'm so proud of the work that our task force is doing to address these issues and ensure that everyone has access to the health care they need. We need to be our own best advocates as women, and again, especially as women of color. Don't be afraid to speak up and ask your doctor questions about your diagnoses, your treatment options, and any potential side effects. And remember to use your voice to help others. You can be an advocate for a family member or share some of the lessons we learn here with your friends. Remember, your health is in your hands. Let's work together to ensure that everyone in our community has the knowledge and resources they need to make informed decisions about their health. Again, thank you for coming, and I look forward to the panel and learning a few things myself. Thank you.
I'm pleased to introduce our moderator for today's panel, Mary Cole. Mary serves today as the Vice President of Clinical Services for Riverside Healthcare. As Vice President, her responsibilities include perioperative services, interventional services, imaging, women and newborns, and patient satisfaction, as well as many other key organizational priorities. She is an accomplished leader who started her career at Riverside in 1979. Mary is a nurse. She is a mom and a grandmother. She was born and raised in this community and is passionate about the quality of care and patient experience Riverside delivers every day. Please join me in welcoming our moderator, Mary Cole.
Good morning and welcome. How many students are in the audience? Kanki, stand up for a second. Let me see how many. That's awesome. It's awesome. It's amazing. So anybody that knows me, we're going to get to the topic in a second, but anybody that knows me, I always start with a story. So back in 1970-71, this was not Kankakee High School, it was Westview High School, and I attended here. Right? And I attended here in 1970-71, and that year, two things happened. Number one, they had a play called The King and I signed up to be in it. So they brought me in a room and said, "Can you sing?" I said, "Well, I'll try." And I sang a few lines, and they're like, "Yeah, no, you can't sing." And then they said, "Can you dance?" I'm like, "Yeah, I can dance." So I had to do a few moves, and I got appointed to be a harem dancer to dance for the king in The King and I. And so they dyed my hair black, put on this really skimpy outfit on me, and the first opening night, my dad was in the hallway, and he had a pop, and I was thirsty and nervous, so I walked out and I said, "Can I have a drink?" And he's like, "Well, who are you?" And then he looked at my eyes and he goes, "Is that you, Mary Angela?" And I'm like, "Yeah, that's me." He said, "You didn't tell me you were going to be wearing that outfit. I would have never let you be." And the second thing I want to tell you is that I was in the very first day of school, I was in line in the cafeteria, and I turned around, and here's this senior who looked like he was very frightened. His name was John Page, and he was a foreign exchange student. And 50 years later, John and I talk probably every week. He's come to America about every 3 years. I've been to Australia. So formed some really good memories here. So excited to see you guys in the audience. So I'd like to introduce to you our panel, very impressive panel that we have here today. Dr. Utundi Akindi, MD, MPH, OB-GYN. Dr. Akindi received her Master of Public Health and Doctor of Medicine degrees at Drexel University in Philadelphia. She then completed her obstetrics and gynecology residency at Louisiana State University Health Science Center in New Orleans. In addition to her education, Dr. Akindi has several published works and research projects. Dr. Akindi, wave to these people. Wave to these people. Thank you. She is also a member of the American Medical Association and the American College of Obstetrics and Gynecologists. Welcome, Dr. Akindi. Dr. Naha Wynn, cardiology, DO. Dr. Wynn received her Doctor of Osteopathic Medicine from Midwestern University of Chicago, College of Osteopathic Medicine in Downers Grove, Illinois. She then completed her residency in internal medicine at Advocate Lutheran General Hospital in Park Ridge. She also went to complete her fellowship in cardiology from Deborah Hart and Lung Center in Brown Mills, New Jersey. Welcome. Welcome, Dr. Wynn. Cassandra Lasher, is that correct? Lasher? Oncology. Dr. Lasher completed her Master of Health Administration degree and Doctor of Osteopathic Medicine degree at A.T. Still University in Kirksville, Missouri. She then completed her internal medicine osteopathic residency and hematology oncology fellowship at Michigan State University in Lansing, Michigan. In addition to her education, Dr. Lasher is very involved in the community and volunteers with numerous organizations. She is passionate about community oncology and providing adequate support services for patients to help them through their cancer diagnosis. Welcome, Dr. Lasher. And Dina, where's Dina? Dina, I know I have you. Dina, I found you. Dina is NP, PhD, primary care. Dina Reddick received her Master of Science in Nursing and Doctor of Philosophy in Nursing from Rush University. Nurse practitioner Dina has been in family medicine since 1982, longtime resident of Kankakee County, and so welcome, Dina. So we're going to make this very interactive. I'm going to start some questions for our panel. As you're thinking of questions, please retain them. You'll have opportunity to ask those questions as we go along. And so I'm going to start with Dina. Dina, one of the questions that we have here are, what are some tests or exams that women should consider to be and stay healthy over their lifespan?
So, if the topic, am I supposed to?
Yeah.
Am I supposed to just pick this up? Okay. Sorry.
There you go.
Is it on? Is it on already? Click it on. There it is. Okay. Actually, with this esteemed group, probably everything that I would talk about in primary care, they would talk about specifically. Certainly men and women need a lot, but if we're talking just about women, of course, we have a lot more parts, so our gynecologists are pretty busy, and I do a lot of women's health too, so certainly things like mammograms, pap smears, special testing, the younger you are, immunizations. As you get older, of course, all of us need to consider colonoscopy, and we can talk about age and things like that if we need to. But one of the most important things is just seeing a healthcare provider regularly. There's a lot of people who really only come into my office in their mid-years, I'm not sure, that's changing now that I'm this age, mid looks different, but your mid-years, and it's because you have a problem you want us to fix. And that's great because we're pretty good at fixing most problems, but the really neat thing is that prevention is the key. So I think seeing a provider regularly is my #1 recommendation.
One more question, Dina. What are some important immunizations that women should consider over their lifespan?
Right. So, you know, we strongly recommend immunizations for our children. And as you get a little bit older, there are some very important immunizations that are coming up, like the meningitis A and B, and hepatitis A, and also Gardasil, which is for human papillomavirus. And again, our women's health experts, our oncology experts, because Gardasil, I'm going to make a spotlight on that one for just a minute. We like to start that as young as possible. It's approved from 9 now to 46. It was 26, it's up to 46 for prevention of anogenital and oral cancers caused by a virus. Pretty amazing, because there's only 2 cancers you can prevent. One is colon cancer. If you get your colonoscopy, we literally prevent cancer. We don't just early detect, right? And Gardasil, very low side effect profile with almost, I think it's over 99% effective rate against preventing high-risk strains of HPV that cause cancer. This is it's like endemic in our country. You may not know it, so this is important. And I know people, it's a little controversial at times, depending on your setting, but we really strongly recommend it. So that's a big one. A little bit older, of course, pneumonia. We want to look at pneumonia and shingles shots as we're getting older to prevent illness in our adult population.
Okay, Dr. Lasher. When should we start and stop screening for cancers, including lung, ovarian, breast, cervical, colon, and why is screening important?
Sure. So this is an area where your primary care physician and regular screenings and checkups is really important because they can help make sure the timing is correct for your screenings. In general, right now the recommendation is that breast cancer screening should start at the age of 40. Colon cancer screening recently was lowered, so now the recommendation for colon cancer screening is 45. Lung cancer screening was also recently lowered, and so now the recommendation for lung cancer screening is at the age of 50 for people who have smoked a specific amount of time and a specific amount of smoking of cigarettes. We also recommend pap smears, and I'll let our gynecologist talk more about that, but definitely when we're sexually active, when we start at a younger age with sexual activity, that increases your risk of things like cervical cancer, and so again, things like the Gardasil vaccine can be preventative for that, but keeping up with your annual pap smears and pelvic exams also can predict early cancers and hopefully prevent progression to more aggressive types of cancer or difficult to treat or cure cancers. So,
Thank you. Another question that I have, and this actually came from one of the students that posed a question already that was handed to me today. So I'll add on to it a little bit. What are some resources for smoking cessation and also for those who want to quit vaping?
So the American Cancer Society has a site where you can look up online for smoking cessation and resources for that. There's also the 100 Quit Now phone number that you can call, which is the Illinois State Smoking Cessation line that helps provide supports for smoking cessation, including vaping. But definitely anything that we can do to help you quit smoking or vaping is really important because it's going to prevent things like lung cancers in the future. Things like cervical cancer have an increased risk when it comes to smoking. Things like leukemias and myelodysplastic syndrome, which we see later in life, can also be prevented by stopping smoking as early as possible. Your primary care physician is also a great resource for helping with the medications that can help with reducing that want to smoke. And we want to help you stop smoking. So reach out to your physician and include us in that process because there are things we can do to help make it easier as well.
Okay, and if you have a strong family history of colon cancer, sibling or parent, should you start screening earlier than 45?
It depends on who had colon cancer and their age of cancer, and that is another really important piece to be asking your parents. In older generations, we didn't talk as much about who had what cancer and what type of cancer it was and how old they were, but really push your family members to find that information out, because it changes what your screening time frame is, what your first date of screening is. And it helps us to know if we need to be pursuing things like genetic testing to find out, should we be doing screenings even earlier for things like breast cancer, ovarian cancer, and colon cancer. So really spending that time to talk with your family about, well, I know you told me grandma had some sort of female cancer, but what was it? It's really important. It's not good enough to say it's something in my stomach. Let's figure it out so that we can really make sure we know what we need to do so that we can take the best care of you as our patients.
Okay, Dr. Nguyen. Ready? Yes. Dr. Nguyen, are women of color at greater risk to developing heart disease?
Yes. As you all know, cardiovascular disease is one of the most common cause of death in women of all age in the United States and even in worldwide populations. And women of color does have increased rate of mortality and morbidity with cardiovascular disease. Traditionally, we know that those traditional risk factors like high cholesterol, high blood pressure, family history, known to increase the risk of heart disease in Black Hispanic patients. But however, there's other risk factors such as environmental factors, stress, economic barrier that prevent them from getting good health care or quality health care. The other factors also including whether premature menopause, high blood pressure during pregnancy can also play a role in that as well.
Okay. Dr. Nguyen, are women's symptoms of a heart attack different from those of men?
Yes, women can present symptoms of heart attack differently than men. For men, the typical symptom of angina would be heavy pressure on the chest, radiate to their arm, their neck, their jaw. Works with activity, when they do something, the chest pain come on. But for women, as well as diabetes patients, they may present differently, such as acid reflux. We do have a patient who come in with acid reflux and keep taking Protonics, but doesn't quite relieve a symptom. And then when we look up into the family history and the risk factor, and we decide to pursue with stress test, and we found that she did have significant coronary artery disease. Sometimes women can also misunderstand the symptom is anxiety or panic attack, and that can also lead to underdiagnosis and lead to poor outcome in women. So make sure you also look at the family history, the risk factor, and when you have those symptoms, make sure you let your primary care know in order they evaluate to make sure they get proper evaluations.
Okay, thank you. Dr. Kindi. What advice do you have for women hesitant to go to a gynecologist?
So the biggest thing that I would say is that the OBGYN office is not as scary as it sounds. We are very friendly, and I find that a lot of women, even younger women, come in, and depending on the age, I don't always do a pelvic exam. You know, if I'm seeing a teenager and there's really no indication for it, I don't do it. And I find that a lot of young women will, you know, they kind of have a breath of relief, like, okay, I don't need to do this part, and we can just have a conversation and talk about, you know, what your lifestyle is, and we talk about what your periods are and whether or not you're sexually active. A lot of it is just us having a conversation. That is the first step, and then after that we can determine what we need to do. And a lot of times the best parts of the day is when I see young women and who are taking charge and being active in seeking a gynecologist. And learning how to, take charge of their health care, take charge of their sexual health, and be proactive in that. So just come in and we'll have a conversation. It's always whatever you're comfortable with. We're never going to push you to do something out of your comfort zone, but coming in and having a conversation is the biggest thing.
Okay, and you might have answered some of this, but what are some things young women should be aware of as it relates to women's health?
So some of my colleagues have already kind of touched upon this, but the biggest thing that I counsel on is the importance of the pap smear and recommending that to begin at the age of 21. And what a pap smear does is we collect cells on the cervix, and the cervix is the opening inside of the uterus. And if there are abnormal cells and that are not identified, that increases your risk of having cancer of the cervix, and that is what we've been referring to as cervical cancer. And we know that cervical cancer is the most common female cancer worldwide. So having a regular checkup to do a pap smear is very important. And the same thing with the Gardasil vaccine. I spend a lot of time in the clinic just going over that, because that is the best thing that you can do, is get that vaccine and decrease your risk of cancer over your lifetime, cervical cancer that is. And I say that I've seen a lot of cervical cancer, and it's a terrible cancer, so I always encourage women and young ladies to get it as early as possible, just so you can take control of that aspect.
Okay, I'm going to have some more questions for the panel, but I did want to address a few questions that was handed to me today from the students here at Kankakee High School, and this is from a 12th grader, and I can answer this question, actually. I'm going to be on the panel. How can young people gain access to health resources in the community? So I can have you answer that also, but if I asked you in the audience, what is Riverside? Who is Riverside? What would you say? What's the first thing that comes to mind? Reverside Hospital, right? So we stopped referring to Riverside Hospital, and we refer to ourselves as Riverside Health System, Health Center, RHC, Health Center. And why is that? Back, I think it was when Phil Campick became the CEO, and he was standing in front of some leaders, and he was talking about the future of healthcare. And he said, we need to go out to our people and serve in the community. The hospital is going to be in the communities. So Riverside has done a really good job of reaching out and making sure that access is easier than it's ever been. And so we have satellites throughout our whole community and the communities in which we serve. And so today is really all about being proactive and not reactive. Being proactive before you have symptoms and not reactive. And as Dina said, getting a healthcare provider, there's many satellites that we have where you can get access. We actually have a couple Riverside employees here today that can help you find a primary care physician if you don't have one, or answer any other questions about access to care that you might have. Any other additional comments?
I would just add that if you guys are like me and you don't like the phone and you don't want to talk to somebody about making an appointment, it's really easy on the Riverside website to also go online, find a provider online, and schedule your appointment online, which is what I did for my family because I hate calling. So especially as young people, if you don't want to have to call the doctor's office, you are welcome to do that online, and it takes kind of that scary step out of it. So I would encourage you to look that up. You just look it up online, Riverside Primary Care, Google it, it comes right up, and you can find a physician that way as well. There's also crisis pregnancy centers in the area, and so if you're concerned about a pregnancy and you haven't talked to your parents about it yet, or if you don't know where to go for a pap smear, or you're concerned about the sexually transmitted diseases and you don't feel comfortable talking to your physician about it, there are other programs in the area, again, easy to Google, that can provide some privacy for you to get those things taken care of, but also provide that screening and evaluation and resources for you if you do have some of those scary things happening.
This came from a student, this question. The student wanted to remain anonymous, which is fine. If young people are feeling pressured or stressed, where do they go for mental health and support if they have suicidal thoughts?
Yeah, that is interesting because whoever wrote that went right to the heart of a huge issue in our country, right? So I'm going to sidebar just real quick and remind you that I used to always tell all my children, so from the time you're born till about 25, your leading cause of death or injury, morbidity, mortality is how we refer to it up here, was accidents. Accidents, all types. So when you're a baby, it's one thing. When you're 25, it's something else. Recently, up in there fighting for first place, besides gun violence, unfortunately, accidents are still up there, but teen suicide. And this is a very, very scary thing, and I think we've talked about a lot of it in the community, but getting to a resource isn't easy because sometimes there aren't enough providers who handle pediatric psychiatry or psychology. And so the really exciting thing is I know Riverside has really targeted that as a priority. And our group is pretty easy to access, although sometimes we do need to go through your primary care to get it done. The emergency room, although I realize that's a scary place, is a safe place for you there because there is a very special team that comes there and meets you and helps during a crisis situation. But the other really neat thing, again, back to what Dr. Lasher was saying, is there's a lot of great online resources, and several of my patients who either have financial issues or just social, they don't have a comfort level talking to somebody in person, they are doing online video counseling and psychiatry and psychology consultations. And you can access that with a Google search also, or your primary care should be able to help you also find some of those resources. I think really, you may not realize it, but your teachers, your coaches, your counselors, your administrators here at your school, it may not always seem that they're your friends. They're your friends. They really care about you, or they would not be here doing this job. It's a hard job and that they're doing, and they care about you guys. And I'm sure there's somebody in that group, maybe not every single teacher, maybe not every single coach, but there's somebody that you know that you would be able to share it with. And I think, I happen to know Mary would agree with me on this. Say something to somebody because people care about you. When we talk about accidents as the leading cause of death and injury, I want to tell you that in your age group, often suicide is an accident. In this age group, there isn't quite an understanding of what that means when I'm going to be doing something to harm myself, and that the intention is more that you need help, you're reaching out for help, and these people really care about you. So that's another good resource, is the people that are around you, even your parents, but sometimes we don't feel comfortable talking to our parents. So there's other adults who really care about you, so reach out to them.
And then I just wanted to add, the National Suicide Hotline is 988. So you can call that number or you can text 988 and you'll reach somebody who can help support you as well if you don't feel like you have anyone else you can get in touch with for support.
I would like to add into that. I really, I think it's very important to address this topic because it's sometimes when you lose your loved one by suicidal, you realize what could have we done to prevent this from happening. And so when you recognize suicidal ideations, make sure you seek for help immediately. I think emergency, if you don't have any resource like primary care physician, or not be able to get into your primary care and get referral to psychiatrist soon, then go to emergency room, because in that way you can get immediate care that you need. The other one is, I want to pass a message to the loved one. Make sure you check on your family and tell them that you love them every day and care about them, and then see what's going on, spend time with them, because a lot of time we're so busy with what we're so busy with our own personal things, and we forgot to check on our loved one, and until something happened, and it's too late. So that's my thought.
Exactly, and just kind of piggybacking off of that, I think a lot of times in the Black community, we don't talk enough about mental health and things like suicide. I think there's a tendency to try to be strong for everybody around you, and maybe bringing up those topics could be considered as a weakness. So it's important for the family members and people who have children who are teenagers to really make an effort and sit down with the kids and just check in here and there, and even if that's something that makes us uncomfortable, but having a conversation and just checking in periodically, I think goes a long way. And then for the teenagers in the room, that's a really hard time trying to find yourself. The hormones are changing. There's just a lot of things that are happening that are out of your control, but recognizing that it's okay to have those feelings, and that doesn't mean that there's something wrong with you, but being able to recognize it and being able to ask for help, I think, is the biggest thing. And even as adults, there are moments where life is stressful and you feel ashamed to admit that you're feeling depressed or that you're feeling anxious. But just recognizing it and knowing that it's okay to reach out, I think, goes a long way.
Very important topic. As you can see, all four of our panelists wanted to make a comment about that. And I would just echo, if you are having suicidal thoughts, go to the emergency room. One more question, anonymous. What are obstacles for young people to gain access to resources in the community? The obstacles.
I can take that for young people, because a lot of time we, especially high school student or people who just graduate from college, financial burden can also prevent people from getting access to healthcare system. The cost of healthcare is rising. One thing is, I've been working at Riverside for the last 7 years. Something that I proud of Riverside Medical Center is we do have financial assistance program for patients who don't have finance or resource that they need to get health care. So when you call Riverside, we do have a number for financial assistance to help you. And if you don't have any insurance, we can also help you to be able to see a primary care provider as well. The other one is the lack of education. Like if you not aware of risk factors and not be able to get to healthcare provider that you want. So the first things I would recommend is when you during your teenagers or adolescent. Make sure you get routine healthcare exam, get access to healthcare, get routine lab workup, and get routine screening exams.
Thank you. I'd like to take some questions from the audience at this time. Please come forward with any question. There's a microphone, there's 2 mics set up, so you can go to either mic and ask questions.
Good morning. Good morning? Yes. Hi, my name is Araceli Sharper. First, I have a comment, especially to you kiddos back there. I was a teacher for 15 years. A few of them were here actually in Kankakee. And for the person who had asked the question about depression and suicide, it might have just been one person asking, but I know that everyone is thinking about it and having troubles, and especially after coming out from the pandemic and whatnot, things have changed so much for us. But that is a very serious question. I'm 46 years old, and as a child, I grew up with a lot of those issues. Had a very difficult childhood. and couldn't find anyone to talk to. I remember reaching out once, and they called DCFS on us and sat me right next to my father, my abusive father, and the rep was across from us, asking me in front of my dad, you know, if I was being abused. And I was like, oh, no, absolutely not. What are you talking about? I don't know who said that. So honestly, I don't remember feeling safe anywhere as a child. But I know that there has to be somewhere out there. I know that great options that they gave us, that the panel gave us, but even as a kid or even as a young adult, there's just some things that we're not comfortable with. But one of the goals that I have at our establishment in Essex is we want to be a safe place for children and young adults to come in and seek out help. So I know that there has to be different businesses or whatnot in this area that are here for you guys. So seek them out. Seek them out. Seek out where you feel safest. Some of the options that they gave us, and there's also options that we could look for ourselves. I know that there's establishments that where you will just click and connect, but also always be very careful. Do your research always on who you're communicating with. Reach out to me. Honestly, I always say that with our establishment in Essex, and we also have a farm. I'm like, I don't know, you know, we used to run a non-for-profit for Royal Family Kids, which is it was a summer camp for foster children, which that led me there because of my experience as a child. And I'm like, there has to be a way to help these kids. So we did that, and that's how I ended up adopting. We adopted our daughter and fostered about 10 children. So please reach out. I'm in Essex. I know that's far, but Google me, Araceli Sharper. I am me, and I'm sure that with our team that we could find someone that you guys could speak to. And I know as an educator, I know it's scary talking to your teachers sometimes too, or administrators or counselors, and I'm not saying anything bad about them, but I know it is scary because they also have a line of communication to your parents, and that's a little scary too with that door right there. And but there are educators that are here to help you. Seek them out. You know, I know that as an educator, there was always an olive branch that I would try to extend. And I was that one teacher that everyone hated because I had everyone in my classroom in my classroom during lunchtime, and I was always outside playing football and whatnot with the students. But because I know what it feels like to be lonely and afraid as a young teenager and a young adult. But again, I'm 46 years old, and I feel like I could say I'm a survivor of a lot as a child. And you guys can be too. So seek out that help. It's very important. All righty? Which then takes me to my question. So like I said, we adopted our daughter. She is 7 years old. We're parents of 26, 23, and 20-year-old, and now so we have little Miss Shyla, that's 7, and she's like an only child. My question for the panel is, we do not know a lot about her history, but what we do know is that she suffers of fetal alcohol syndrome, and she was born with cocaine in her system, and she is a fighter. We started therapy and all these like 5 days a week as soon as she came home to us. She was 1.5 years, and she was still withdrawing from a lot of substances that she was exposed to, but without knowing a family history. And I think a lot of kids may not know their family history or can't ask about it. How do we deal with that? What do we do about that? I've taken her to various doctors, and they're just like, well, FAS isn't diagnosable, which I understand that, but we know for a fact that throughout the pregnancy, Mom was a heavy drinker. She was born, again, with cocaine into her system, and there was alcohol levels present in Mom when she went into delivery. She also admitted to her drinking during her pregnancy. So if we do not have a lot of that history, what are we supposed to do? How do we figure that out? What questions do we ask?
That's a good question.
Our healthcare providers.
Yeah, that's a great question. Who would like to handle that question.
Thank you for the question. In terms of not knowing a full family history, there are ways to get around that, and there are age-based screening recommendations that are in place, and also just bringing, coming into the office and having a conversation and seeing, are there any symptoms that are, occurring that could lead to suspicion of a disease process versus another. So it would really be coming in, having a conversation, doing a physical exam, and having an understanding of where that individual is at that point in time, to then come up with an assessment, come up with a plan of, do we need to order these blood tests? Do we need to consider X, Y, and Z based on what this individual is as a person? I think that that's the biggest thing when there is no family history, unfortunately, is, we can still provide comprehensive care just by looking at who that person is, and then looking at what the recommendations are for certain age ranges.
Really quick, is there somewhere where we could access a list of questions to ask? Because I know I have been in situations and know people that have been in situations where you go in and try to have that conversation with your healthcare provider, and they just want to run a blood test and say, no, everything is good, there's nothing to do, and you're kind of stuck. They don't want to hear what we're thinking. And so how do we get past those barriers too?
I think a lot of people have that experience, and I think it's unfortunate. As providers and physicians, our job is to make sure that you're comfortable to ask your questions, and you know your body best. And so if there's something that's changing or something that's different, it's our responsibility to listen to that. Sometimes that does require us to do some lab work, to do some further evaluation. Sometimes it requires or helps to know a family history. I've had people who've come into my office with a diagnosis from 23andMe that we've had to sort of confirm. And so just listening is a huge part of our job, I would say, especially primary care. And so if you don't feel like you have a physician who's listening to you, I would say it's time to find a new physician, honestly. Because that's what we're here for. And you need to feel like you have somebody who will listen to you and will hear you and will pursue on your behalf whatever medical condition may or may not be going on. And if nothing else, I tell my patients a lot of time, the peace of mind of knowing that something is negative is also really important. And so we have to pursue that for you. So if you don't feel like your provider is listening to you, I would tell you to find someone new.
Thank you very much for the question.
I'm sorry.
Oh, wait,
Real quick, I was just going to say also, this might be a situation where an online appointment might not be your best choice, because it might be better for you to connect with the office, like when you're establishing with that new provider, so that they understand that they might need a little bigger block of time to be able to go through a complicated situation like this. And then if you bring as much as you can of what you already know, those past records, all of those things will help a primary to be able to focus in for you and not make it feel like they're just blowing over what you're saying.
And you don't always have to come in with the answers. If you come in and you say, okay, I'm concerned, or I need more information about fetal alcohol syndrome, then I would be able to pull up some resources for you that are credible and print that out for you, and then you can take it home and you can read it and then formulate your questions, and then you can come back for a follow-up appointment and we can address certain things, because there's a lot of information online, and it's hard to find the right information about certain conditions. So I print out handouts for my patients all the time, so you can also make an appointment just to start that initial conversation.
And then one more question, since you guys are here from Riverside. How is it possible for the communication to start happening or getting better, or I can't think of the words to say, where the healthcare system can support the student body and have that conversation going on continuously, especially like with the question that came about depression and suicidal thoughts. Also there's, teen pregnancy, there's abuse. I've met a lot of students that were in physical abusive relationships with their partners in high school and whatnot. And I understand and I appreciate the resources, but is there a way where we could start the conversation on how to give the student body that access to just a safer, I don't know, easier isn't even the word, some type of way where they do have access to you, and it can be anonymous, so that they feel safe and have that support that is really needed, especially those middle school, high school years.
I agree, and thank you so much for those comments. I'll take this back to our group, our leadership group. We've had several conversations on mental health for our kids, not only our kids, but our community. So thank you so much. All very, very important conversations. Next, Dr. McChristian? Thank you, Dr. McChristian. Next question.
Good morning. My name is Adrienne Kelly. I'm visiting y'all from North Carolina today.
Welcome.
Thank you. I have a question about diabetes. I'm noticing that there's an increase of people getting diabetes in their adult life, and I'm wondering if you could talk about prevention as well as cure, if there's a cure, those that might be indicated that they're pre-diabetic, how they manage their, I believe it's called the A1C. You could talk about that.
Dina, want to take that one, Dina?
Wow, yeah, diabetes is a huge issue, and you could do a whole day conference on it, but a great question, thank you. So, yeah, prediabetes, type 2 diabetes might be your next step, and then, of course, people who are insulin-dependent diabetics. You can't cure insulin-dependent diabetes, but you can manage it very well. But for those people who are pre-diabetic and diabetic, and certainly women of color, the CDC and the American National Statistics resource tells us that obesity is increased in our women of color. And of course, that goes back a lot to socioeconomic and environmental issues that we talked about earlier, but that puts you at risk for diabetes. In addition to, of course, to family history, management of diabetes is really all about nutrition, exercise, but then you get to the socioeconomic issues of good food. How do I get good food in the house and on the table, and where are my resources? I spend hours a day working with my diabetics to try to help find ways to work through that. Riverside has an excellent diabetes center that we can send people to who do nutrition as well as lifestyle, as well as management, education about all of the products that are used. Your provider should be talking you through some of that. And of course, some people, it's really quite simple. You go in there, they find out they're prediabetes, and they turn it around. They're just not having it. And the next time they come in, their hemoglobin A1C or glyheme is under control, and you can tell that they took it all to heart. You have other people who really struggle, and it's an up and down pathway, just like almost like addictions, right? It's food is an addiction for Americans. And so managing your nutrition, specifically carbohydrates, is really what we're talking about, and carbs are in almost everything you want to eat, and that's the controlling factor. So there are a lot of great resources out there for exercise, for supporting exercise at any age. Of course, our kids, obesity in our children and in our teenagers is up in America. So diabetes is really on the rise, and it in all cardiovascular health increases 30-40% when you're diabetic. So it's an extremely important topic. I'm not really sure I have time to go into a lot more detail. Did I answer anything?
Yeah, just one follow-up. We are bombarded, all of us, with commercials of medications, and, you know, even with cool jingles, and you might be dancing to those as you're hearing about various medications. Just an opinion around, you know, focus on nutrition. When is it time to actually get on a medication? Any comment about that?
Sure, I'll start, and if you guys have an add-on. So yes, there's a time both with your hemoglobin A1C, with the time frame to which you got to that high level when you start medications for sure. So nutrition and exercise in a motivated patient, I've seen people literally drop from double digits to normal without medication. So it works. But in most people, you probably need to start medication. Are you asking for a number? Around 6.5 hemoglobin A1C, that's where we say you're diabetic. In a really motivated patient, I'll give them 3 months to say, okay, fix it, let's do this, and not start medication. But that's about when we start medication by mouth, oral medication. All of these big meds on TV and all of that, so injectables that are weekly that also help you lose weight, they work. They do work. They're expensive. You can't always get them. They certainly aren't first line, but in people who are pre-diabetic and obese, we are seeing them used, and they are effective. So that's a really long and very important conversation you should have with a primary care, whether that's medication you should consider.
Thank you.
Next question?
So first, I apologize. This is actually a comment, not a question. We would be remiss if we didn't make sure that everyone knew that we do have 2 health clinics. We have a health clinic at the junior high, and we have a health clinic here at the high school. In fact, we invested a couple $1 million to actually move our health clinic to the side of the building where it's right next to the medical academy. So eventually we can start building that partnership with young people to go into the medical field. The health clinic has been available to our students for, I want to say, 30-something years, because my daughter, I have 3 children, one is a couple in their 30s and one, that's 16 here at the high school. And so I know my daughter had access to the health clinic, and even my son, who's here at the junior high, occasionally he'll get his physicals for athletics through the health clinic. So I just wanted to make sure that we're know that. The other thing that's really important to know is that we have a community partnership coordinator, and when we have a community partnership grant through Illinois State Board of Education, and I want to introduce Rebecca Parks because she's going to explain a little bit about our partnership really focuses on mental health for our adults and for our students.
So I just wanted to share for our students, we do have 2 and a very part-time therapists, LPCs, and they are seeing students for individual therapy in our schools. And so they are here at the high school, at the high school and the junior high. We do have a therapy office in our clinics that they see them there. But then at the smaller schools, they find a room and they utilize that there. But that's free. We do not bill insurance due to our grant that we have. And so anybody can ask their social emotional coach who that is, or if you are looking for that, you can contact me, Rebecca Parks, or if you know the names Matt Heading-Hess, Hernan Cortez, and Dexter O'Donnell, those are the therapists that can be seen. And then for our adults, we've partnered with Rise and Thrive Wellness, and so Megan Campbell, the owner of that, is providing individual therapy for our teachers and staff, and that is free and can be seen as well in those spaces. And I wanted to mention that both Matt and Hernan during the summer are going to be providing this therapy, and something very unique is Hernan is Spanish speaking, and so he can address those needs as well and is able to see community members as well.
Thank you so much. We're going to take one more question.
Hello. So I have a question about autoimmune disease. And for young adults or teenagers, like when you don't have adequate insurance, sometimes you get turned away a lot when it comes to like really being diagnosed. I was just telling someone how I started having joint problems when I probably was 19, but because I didn't have insurance, I would kind of go to the emergency room, get sent back home. It would be, oh, you got this and you have that, you have this and that for so many years, when I probably could have it's kind of hard to take preventative measures when people and systems are doing things like that to you. So I really didn't get a true diagnosis until I was an adult with good insurance, and then I could go to the arthritis and kidney center and things like that. So like for children, it's really, I got diagnosed at like 15 with a thyroid problem, which I didn't know was kind of like in line with me having an autoimmune disease. And I was 15. So just like when you're a kid, like what do you do to kind of take preventative measures? Because autoimmune diseases are a big thing these days. A lot of people are suffering from all types of autoimmune issues, and I would just like young people to be able to have more preventative care so that they don't end up with issues down the line that are really, really debilitating when they could have had more help when they were younger.
Thank you for that. It kind of helps me segue, and I'll let if anybody wants to respond to that, but I'll also segue that we want our community to have access to care. We do have a couple, or are they set up on that end? Okay, on that end, there you are. Hello, guys. On that end, that if you have questions about access, we want you to have access to care. We can help you navigate through that. It's our mission. And so, great comment. I agree with what you're saying, that access to you as a younger child would have been helpful. So we want to provide that. Any panel have anything to say?
I just add that when it comes to needing a specialist or further evaluation, that really still does start at the primary care office. The other benefit of the primary care office is that even in underinsured or uninsured patients, we still recognize that primary care is a priority. And so getting established with the primary care physician where they'll be able to do the workup, get social work assistance so that we can make sure things are covered, see if there's a need for foundation assistance, for financial assistance. So those things can start in the primary care office, and then we can help make that progression to any further evaluations by a specialist. It's hard when people have chronic illnesses to be evaluated in places like urgent care or the ER because they're not, they're not trained necessarily to do additional workup and to pursue it beyond what's the acute problem. It's just not what they do in those places. And so it's hard when there's a chronic problem to get a good evaluation in an acute setting. And so we want to make sure that people are established with a primary care physician or primary care provider so that those things can be addressed at the right time, and then we can help support with the help of the hospital to make sure that people are getting what they need from our system and from our perspective so that we can get you to the healthiest we can at the earliest age we can to prevent things down the road.
I got one more question. So when you have arthritis and you're pregnant, like, do you all have ways that is there a more like where the systems are talking? I noticed when I was pregnant, like nobody talked to the person like for me for as far as like having arthritis, but also being pregnant. Like it was like these people aren't communicating with each other about my healthcare like plan. So how do you go about that?
So yes, how that typically happens is if you are already seeing a specialist and let's say you were seeing a rheumatologist and you come in and we're doing your pregnancy stuff, I have you follow up with your rheumatologist, and then I get the notes and whatever recommendations that they make, I'm aware of it, and they would also get my notes and summaries and things of that nature. So there would be communicating back and forth. In the ideal scenario, is you would keep going to your rheumatologist, and you would keep going, coming to see me and making sure that the medications that you would be on are safe for the baby and things of that nature. So yes, the way that it should work is that, there should be communication between all the providers, but I recognize that sometimes, for whatever reason, that doesn't happen. And, just to kind of go back to your question about the insurance, non-insurance thing, I do recognize that the quality of care and the type of care does vary with whether or not you have insurance or not, and the type of providers that you are able to see and how long it takes for you to get in. So those are very real things that are happening. But, like Mary said, we have people out who can hopefully provide some assistance to those who need that.
Yes.
Thank you.
Thank you.
I have the answer kind of to her question about access. I'm Marcia Brown Medina from Aunt Martha's Health and Wellness. We also need to recognize that we have 2 federally qualified health centers in our community, which is Aunt Martha's and also Community Health Partnership. And we also have an Illinois Welcoming Center program that helps immigrant families. I think because also that is a challenge in our community, and it is going to be more so a challenge as we get more and more new arrival families, and really they're not staying up in Chicago, so they're coming down here. So we need to continue to be a welcoming community and make sure also people have language access. So, and also the 211 resource line is Kankakee all the way down to Bloomington. I think a lot of people forget about that too. So, and that has all the services, social services on there, and you just give them your zip code and they let you know who you can contact for a resource. So 211 is also a great number. Thank you.
Thank you.
I have a question about anencephaly, basically, for like when babies are born without brains or skulls. Are they alive when they're born? I know that like they're brain dead, of course, but is their heart still beating? Are the parents allowed to hold them when they're born? And what do you do with the baby when you're done? Like when skin to skin is done or whatever happens after like.
Dr. Kendi, yep, good question. Dr. Kendi's going to take this.
That's
And if you need to speak with Dr. Kendi after, you
Yeah,
can
do you
please know
wanna
that
find me
she's.
afterwards? I can meet you over here and we can have a conversation about it. I'll just say that that's a very unfortunate situation when that does happen, and it's very stressful for the mom and the family, and it does take a lot of coordination of care. Just to talk about what to expect during the pregnancy, you know, if you want to continue the pregnancy, and what to expect at time of delivery and all that. So that's a tough situation. Yeah.
Thank you.
Yep.
One thing I think is really neat, some of you may not know, and I'm pretty sure we still do it, so tell me if I'm wrong, is we have a wonderful program at Riverside for pregnancy loss in the delivery setting with skin-to-skin pictures, special remembrances that the family is allowed, and counseling during the delivery, during that special time afterwards when you might be having to say goodbye to a dream of a beautiful, healthy baby. And I've always thought that was a wonderful program. So that is also available for those of you who have ever had to go through that.
Please feel free to come over and talk to Dr. Kendi after this to get more of your questions answered. It's a very serious and sad situation. I'd like to give our panel a round of applause for doing a great job. And I would like to thank all of you for attending today. I think we have Mia. Mia's going to do some closing comments. Mia works with Robin. All right, you can introduce yourself. Okay. Thank you.
Thank you, ladies. Thank you. All right, now that I'm up here in the spotlight, I prepared some songs for you all. No, wrong place. Hi. My name is Mia Carter. I'm the outreach manager for the Congresswoman. And we put this on today because, one, we wanted to make sure that the community is aware of resources, because that was a lot of questions based on resources. But the other one is that recently you've seen a lot of press or media about how Black and brown women are dying at higher rates than their counterpart, whether it's maternal health, you know, during pregnancy or things like that. And I found that to be quite disturbing. I mean, you know, I'm sure that these panelists and the professionals here can tell you all the reasons for that. Socioeconomic, right? Lack of access to adequate health care. But some of it is that we just don't fight for ourselves. We have to fight for ourselves. I heard someone say, if the doctor not doing it for you, find another one. If you don't feel comfortable, if I can't walk into my doctor's office and tell them the most intimate parts of what's wrong with me, I'm going to miss the opportunity to be the healthiest that I can be. I did not take my health seriously when I was younger, so now I am a diabetic. I have nerve damage in my feet. That's a very debilitating disease. But it was because I didn't eat right. I didn't act right. I didn't ask questions. I wasn't even thinking about that. So you young people up there, you're not thinking about I could have diabetes when I'm eating McDonald's every day. You're not thinking about that. So we have to think differently about our health care. We have to fight for ourselves. We have to be an active participant in your life. Whether it's school, whether it's health care, whether it's what you're going to do for a career, all of those things matter. This matters. This message matters. You have doctors up here that's telling you, pay attention to your body. And when something is not right, find out how you can fix it and start early. If grandma, mama, and uncle died from cancer, you probably have a genetic possibility. You have to pay attention and fight for yourselves. So we wanted to do this because the Congresswoman is very passionate about the health care of black and brown women and the disparities that we know exist. So now that we know, what are we going to do? We know now. So now what? Are we going to keep doing the same things that we always done and expect a different result? Because we know the definition of that. That's insanity. So we're not going to do that. You're going to leave this room today, and whatever is going on with you, you're going to find somebody that you can talk to about that. There's a whole table right back here full of Riverside people that's willing to help you right now. Right now. Do it right now. Go to them and say, hey, I have this. What recommendations do you have for me to talk to my doctor? Or I need a doctor. Or can you help me with this? The information is there. I'm going to lead you to the water, but I can't make you drink it. You have to do this. You have to take charge of your health. That was our point today. So thank you so much for joining us. We want to make this kind of an annual thing with Riverside. We want to expand on this. We want to figure out how we get the message out into the community. And Dr. Kendi, little black girls need to see your face. They need to look at you and say, this is what's possible for me. This is a woman that's going to listen to you, that's going to, and I know all of you will. But sometimes seeing something makes you feel like you can do it. So that's the message I'll leave you guys with. Thank you so much. I'll be here if you need anything from my office or you have any questions for me. Riverside, you guys are the bomb. Thank you so much for this partnership. Thank you, doctors, for all that you do. I know that, this is a tough job y'all have. It's tough out there because, we patients, we don't listen. So thank you very much. Be safe wherever you're going next. Anyone who wants to speak to the panelists, I think they're going to stick around for a few minutes. And thank you, guys. Thank you so much. Bye.